Thanksgiving I can't believe it, just a week away. A lot of families are trying to figure out how to serve dinner to a crowd without getting sick. Sorry about that. Bad timing. Here are some advices. Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. I am not sick, for the record.
Well, and let's be clear, the sick we're talking about is not from food poisoning. We're talking about from other things. So let's take a look at great to see you, doctor, by the way. Let's take a look at the most recent national data about COVID-19. The CDC reports that nearly 70% of Americans are now fully vaccinated against the virus, but only 10%, a tick over, 10.1, of people 5 and older have actually received that updated booster. So the question is, do you think that low number, that 10%, makes it more likely we will see a surge of cases after the holiday?
It's really hard to say, but it certainly is possible. What we do know is that immunity from a primary COVID vaccine series and immunity from a prior COVID infection both wane over time. And we know that if you get this Omicron specific booster, it will boost your immunity and protection against Omicron infection. So it's really hard to say because so many people now also have this sort of combo hybrid immunity because of a combination now of previous vaccines and an infection. But I think it's still safe to say that in general, if it's been at least several months since your last COVID vaccine or your most recent COVID infection, you would benefit from getting the booster, and it's not too late to get it.
Oh.
Doctor, the CDC used to say that we should ask others about their vaccination status before we agree to gather with them. What's your advice this year? Things are different this year.
Things are different this year, and it's gotten a little bit trickier based on some of what I was just describing, this combination of immunity that people have. I think those discussions really can boil down to your comfort level with the people that you're gathering with and thinking about the risk level for the people who are getting together, particularly if somebody in that group has a compromised immune system or they are at risk for more severe COVID infection. If you feel comfortable asking people their vaccination status coming into that setting, that's not unreasonable. It's certainly completely reasonable to ask that anybody who has symptoms of a respiratory illness please stay home. And I also think it's reasonable to ask people to do a home test before they get together for the day.
You're brilliant, because that's what I was going to just ask you. Some people may want to test for COVID before they travel. So how well did the current test detect all of the strains that are circulating right now?
The current tests still work great for all of the strains that are circulating right now. We have no indication that they have decreased sensitivity even for some of these Omicron subvariants that are becoming more predominant. So they still work. They work great.
Dr. Moffitt, if we don't see you,
happy Thanksgiving.
We're thankful for you, and happy Thanksgiving.
Good to see you.
And
too.
to our
Have a great holiday.
viewers, you too. If you have COVID-related questions that you would like our experts to answer, it's easy. Email them to ask@wcvb.com.
We turn to 5 on your health right now.